thank you everyone for joining Dr. Felipe Jimenez and myself for this third quarterly webinar here at NV Medical. This is a great one for springtime, and we're going to giving you a lot of tips and tricks and refreshing your memory and how wonderful the SilkPeel is to use in your practice, as well as to really perfect the outcomes for the patients that come in for the SilkPeel. Dr. Jimenez, thank you so much for joining me again. I really appreciate the time that you spend with us. I know that everyone really loves to learn about all of the information that you have to share.
Well, thank you, Cindy. I truly appreciate that introduction, and thank you to everybody who took the time to join us today for our third quarterly webinar. Definitely look forward to, just going over the basics about SilkPeel, what it is, what it does, what really makes it different from other competitive devices out there on the market. And I also especially look forward to sharing some tips and tricks on how to treat the eye area and the lip area with our SilkPeel device as well.
Yes, absolutely. Well, believe it or not, it's April and it is spring. So I know in some areas of the country, you all are really enjoying spring-like weather. And for many of us in the Midwest and north of the U.S., we haven't gotten to see spring yet. So looking forward to seeing those flowers pop up. And, after the long, tough winter that we had, especially this one where we've had a lot of extreme conditions with cold and wind, everyone's skin is really dry, dehydrated, and they really are looking for a renewal. And that's what this webinar is about, is not only to help you sort of refresh your knowledge and passion for the SilkPeel, but also to renew all of your patients' skin as they come in through your doors into your practice, looking to feel better and to kind of do a do-over, which is great for around springtime. I feel like people really do want to clean out their closets and really get a hold of what's going on in their lives even more than they do after the first of the year. So this is a wonderful time to have a spring event and, again, to feature a wonderful device like the SilkPeel. So Felipe, tell us a little bit about, I know we all know the term dermal infusion. We all know that it's patented part of SilkPeel and what is very different from us than any other treatments out in the marketplace. So tell me, what does that mean exactly?
Absolutely. So dermal infusion is really what sets SilkPeel apart. So if you look at how SilkPeel works, or how the procedure works on the skin, it's very, very simple. So basically, we use vacuum, okay, to go ahead and bring the skin up into the handpiece. Okay, in doing so, it brings it in contact with the diamond encrusted tip. And as the operator goes ahead and glides that handpiece across the skin, two things are happening simultaneously. Number one, you're abrading that stratum corneum off the skin, so you're exfoliating away the dead skin cells. And at the same time, you're simultaneously infusing a solution into the skin, and you're doing that via pneumatic pressure. Okay, so basically what that means is when the solution reaches that tip of the handpiece, it's actually forced into the skin with that pneumatic pressure, such that that solution is able to penetrate not just past the stratum corneum, but it gets into the viable layers of the epidermis and goes down as far as the dermal epidermal junction, and really that superficial dermis. So really that's what really sets SilkPeel apart from other devices that claim to do what they call wet microdermabrasion, where as they're abrading their skin, the skin of their patients, really what they're doing is they're dripping solution onto the skin that really lubricates the skin as you're exfoliating away those dead skin layers. But it really does nothing to really drive the penetration of these solutions into the skin. So that's really the biggest difference between dermal infusion in the SilkPeel and the wet microdermabrasion of other devices out there on the market today.
Yeah, and when you're explaining the SilkPeel to patients that haven't experienced it yet, you can really share with them that this is truly a therapeutic medical treatment that takes less than 20 minutes with zero pain, very comfortable, and really a lunchtime procedure with no downtime. This is one of my favorite slides, and now that Felipe's explained it to me more thoroughly, I even love it more because I understand even how much more powerful than I thought the Silk Peel was. So tell us, what is this slide? Where did we get this?
Yeah, so in the previous slide, we were talking about dermal infusion and how it really sets the Silk Peel apart from other competitive devices out there on the market today. But this slide here really shows you the proof of what dermal infusion can really do. So we have a really neat picture there on the in the middle of the slide. It's actually divided into two, okay, but it's really just one picture. And what you're looking at is a single punch biopsy where half of it, actually the right half of it, has been treated with SilkPeel. The left half of it has not been treated with SilkPeel. So what are the biggest differences between the treated side and the non-treated side? Well, the treated side on the right, you'll notice that it's missing its stratum corneum. Okay, that's that dead layer of skin at the surface of your skin. Okay, the other thing you're going to notice is that that dark pink layer, which is your epidermis, is really swollen. Okay, so it's a lot bigger than the epidermis on the left hand side of your screen. As a matter of fact, the far left hand side of your screen, that's the normal size of the epidermis there. So it's much smaller. It's about half the size, if you will. Okay, the other big difference is that you're going to notice that on the right hand side, within that epidermis, you're going to see these little bubbles. Okay, they look like white little bubbles, and these white little bubbles represent the solution that has been driven into the skin through the use of dermal infusion in the Silk Peel. Okay, and again, it's that dermal infusion, it's that pneumatic pressure that really helps to drive that solution down as far as the dermal epidermal junction, or if you will, the superficial dermis. Now, you'll notice that on the left-hand side, the non-treated side, okay, you still have the stratum corneum intact there, so that dead layer of skin has not indeed been exfoliated away. You'll notice that half of the epidermis on the left side, it looks to be swollen with the solution. The other half on the left-hand side is thinned out. Okay, so that's the normal thickness of the epidermis. So basically, on the side that is swollen, okay, on the non-treated side, okay, that's what we call the leading edge. Okay, and what that means is that the pneumatic pressure that we use through the SilkPeel is so great. Okay, the force is so great that it can drive solution not only in the treated side of the skin, but it can also force that solution onto the non-treated side as well. Therefore, you get that leading edge, okay? And that's really what allows you to get excellent penetration of these solutions in the skin. And really, again, what sets SilkPeel apart from other devices on the market today.
It's just a fantastic slide because I never really understood. I knew the Silk Peel was powerful, but this is just really shows just exactly how powerful it is. And speaking about the power of the Silk Peel, I get a lot of people that tell me that have used many other devices, when they do purchase the Silk Peel, they're absolutely blown away by how precise it is and how powerful a machine it is. And we know that we only sell to medical practices. So it's very important to know that you have a medical device that is performing a medically therapeutic treatment. If you look at the bottom of the slide, you'll see all of these US patents. And so these are patents that we carry for the machine itself. And when you look at the two readouts there, you'll see one is for flow and one is for vacuum. So what does that mean to the patient? That means that no matter who is giving the treatment, they're going to get machine precision infusion and exfoliation every time they come in for a Silk Peel. So I think, Felipe, now on this slide, you can tell us why that is.
Yeah, absolutely. So this is our handpiece, our SilkPeel handpiece. And if you'll recall, we talked a little bit about dermal infusion, what it is and what it does. But what allows the SilkPeel to actually create that dermal infusion? Well, that's the handpiece, okay? So the handpiece basically does several things, okay? So number one, if you look at the front of the handpiece, okay, you'll see that it does have a diamond encrusted tip. Okay, so that's really the tip that does all the exfoliating on the skin. But around it, you see that there's going to be a plastic tip. Okay, so basically that diamond tip is actually recessed behind that tip. So if you were to put that handpiece on your skin without any vacuum flowing through it, you definitely would not be able to feel any of those diamonds, okay, because they're not coming in contact with the skin. So what happens is when you apply vacuum to this handpiece, and the vacuum actually comes in through the side port, basically what that does is it helps, again, to pull that skin up into that handpiece, okay, and it brings it in contact with those diamonds. So as we talked about before, basically all the operator needs to do is simply glide that handpiece across the skin, okay, and you're going to get even microdermabrasion or dermabrasion every single time. Okay, but we also talked about that other component of dermal infusion, which is being able to infuse solutions deep into the skin. So in the handpiece, the solution actually comes through the back end of that handpiece, okay, and it goes into that chamber, that front chamber, and basically, as we talked about before, once it gets into that chamber, what it does is it strikes the skin with a positive force. Okay, that means that it strikes the skin and it's able to force, actually the pneumatic pressure is able to force that solution deep into the skin. As we saw in that punch biopsy before, it's able to force it down as far as the superficial dermis. And that, again, is really what sets the SilkPeel apart. And again, you know, as Cindy mentioned before in the previous slide, we definitely have U.S. and certainly international patents that not only cover the device itself, the dermal infusion process, but also our handpiece as well.
Right, and then, and as we talked about before, all of the dead skin, everything, the debris that's in the pores, the blackheads, the whiteheads, everything is going to get removed and deposited in the waste jar. So there is no downtime, there is no flaking, you know, like a chemical peel. So everything that you're doing, as in, it's like a prisoner exchange. So all the bad stuff's coming out of the skin, and we're infusing all of the good stuff, and that is going to be whatever we choose for the skin that's going to best fit the patient's needs. So it's great to, I mean, after the SilkPeel, we love to show the waste jar because everybody goes, oh, it's so gross, but it's so great. And that was really in my skin. And it's a very easy way to get them to rebook. So Felipe, let us talk a little bit about, I mean, two of these solutions are patented technologies. One has just replaced our old acne solution. But tell us why we chose these four different types of solutions to be infused into the patient's skin.
Yeah, absolutely. So each of these four different solutions definitely we created them to really treat four different indications in skin, which are dry skin, signs of aging, hyperpigmentation, and acne as well. Now, this particular slide really gives you a sense for also how SilkPeel is different from other devices out there in the market. So if you look at traditional microdermabrasion, this is crystal microdermabrasion. It's more of a one-trick pony, right? So all patients that get treated with traditional microdermabrasion, you know, obviously it's always going to be the same. You're basically going to sandblast their skin, and in doing so, you're definitely going to exfoliate away that stratum corneum. But that's really all you can do. You really can't tailor it to different specific skin conditions. Okay, and then we also talked about other competitive devices out there that classify themselves as wet microdermabrasion. Again, those devices as well are sort of one-trick ponies as well, because every patient is going to receive the exact same solution that wets the skin. The procedure is going to be exactly the same for every patient. Doesn't matter whether they have acne, whether they have hyperpigmentation, they're always going to get the very same procedure. With the SilkPeel, what really sets it apart is that we are able to tailor the SilkPeel procedure to the treatment of different skin indications, right? As I said before, these are just four of the ones that we treat: dry skin, anti-aging concerns, hyperpigmentation, and acne. But we definitely have doctors out there, some of our accounts, that definitely uses SilkPeel for off-label uses, such as for treating things like rosacea, keratosis pilaris, stretch marks on the skin, you name it, and they're able to do it. As a matter of fact, they're even able to treat acne on the back with our SilkPeel body system as well. So that again is just another point of differentiation between SilkPeel and some of the competitive devices out there on the market today.
Now, this is one of our, hero products, our Lumixil product. We have it in home care for people that want to provide that as well when someone's on a series of treatments of silk peels. But we're going to be showing some before and after slides, and I wanted to remind everybody that when we're showing these slides, these are just silk peel treatments only. There is no home care assist with these before and after. So they are quite amazing. But before we get into the before and afters, tell us a little bit about that Decapeptide 12 that you were so important in bringing to the marketplace.
Yeah, absolutely. So with the Lumixil Pro Infusion, basically what sets that apart is that it does incorporate our Decapeptide 12 technology. Decapeptide 12 actually has its trade name is called Lumixil. Lumixil also happens to be the brand name of our products as well. So the claim to fame there is that Decapeptide 12 works exactly the same as hydroquinone, okay, so that it inhibits the tyrosinase enzyme, the enzyme that essentially can create melanin in skin, but can also overproduce it in skin as well to produce the hyperpigmentation. Now, what sets Decapeptide 12 apart from hydroquinone is actually twofold. So, number one, in laboratory tests, we saw that Decapeptide 12 actually inhibits that enzyme, that tyrosinase enzyme, 17 times more potently than hydroquinone. Secondly, what we saw is that our Decapeptide 12 is definitely not cytotoxic to any skin cells whatsoever. So that means that it doesn't kill any of the normal skin cells in skin. With hydroquinone, that's not the case. So hydroquinone works in two ways. It works by inhibiting that tyrosinase enzyme, but at the same time, if you use enough of that hydroquinone, it will definitely kill the melanocyte cell, initially killing the machinery that can actually produce pigment in skin. So those are the biggest differences between our product and other products out there that definitely contain the hydroquinone.
And it's completely irritation free. So it's not going to
Absolutely.
irritate the skin. It's not going to make it red and itchy. Really, even the most sensitive skins, we've done the Lumixil solution on, and they've been very, very pleased with the results.
Absolutely.
This is another newcomer to the lineup. We before had the clarifying with I believe it was is it a 1% salicylic in that formulation?
Yeah, it was a very low percentage. It's at 0.2%, as a matter of
Oh,
fact.
that's right. So, but now we've got this new technology that we launched at the AAD last year. So the Clarity MD Home Care Kit has been in circulation throughout the world for the last 12 months, and we've done phenomenal with it. And I think we might have launched this solution maybe 4 or 5 months ago. And again, we keep running out of it and keep having to do back orders because people are going through it as quickly as we can make it. So Felipe, let's tell the people that haven't experienced this new formulation of acne solution, what they can expect from this and why it's different.
Yeah, absolutely. So definitely, let's look at the differences between our old clarifying solution and our new Clarity MD Pro Infusion solution. So basically, with the old clarifying solution, basically its claim to fame is that it incorporated salicylic acid in it, okay? But it didn't really have anything else that would help with the P. acnes bacteria or the inflammation or anything like that. So basically, with the advent of the Clarity MD Pro Infusion solution, basically what you're getting is not only that salicylic acid, but you're also getting our PCX technology, which we incorporated into it. And basically what this technology does is it helps us to solubilize a new botanical compound called bakuchiol, which is super, super insoluble in any kind of aqueous or water-based formula, okay? So what's so good about that bakuchiol? What does it bring to the Clarity MD Pro Infusion that the old clarifying solution doesn't have? Well, Bakuchiol, as I said before, is a botanical, but it kind of has three different functions. Okay, so number one, it kills the P. acnes bacteria, so it's an antimicrobial. But at the same time, it also helps to regulate the production of sebum in skin, very much like a retinoid, like a tretinoin or retinol, something like that. But at the same time, bakuchiol also has anti-inflammatory properties as well that are just excellent at treating things like inflammatory acne on the skin. So that's really the claim to fame here with the Clarity MD Pro Infusion, and really what sets it apart from the old clarifying solution.
And can we talk about, because I know we, when we're speaking about the Clarity MD, the technology, I know that we talk about being, just as strong or stronger than benzoyl peroxide, with not a lot of the downsides for that, and that we have no alcohol. Can you kind of speak to the efficacy on those points?
Yeah, absolutely. So definitely, when you look at the ability of bakuchiol to kill the P. acnes bacteria, you see that its efficacy actually comes closer to that of clindamycin, which is a commonly prescribed antibiotic for the treatment of acne, which basically means that the efficacy of bakuchiol is actually a lot better than that of benzoyl peroxide. So definitely it's just a wonderful compound to have, and again, it's safe for use with all skin types. Now, the other great thing about that is, as I mentioned before, bakuchiol is super insoluble in water, okay? And as you know, with all of our pro infusion solutions for the SilkPeel, all of them are about 60 to 70% water. So it's difficult to really solubilize something in these formulas without the use of some sort of an alcohol or something that would help to solubilize these insoluble compounds. The neat thing about Clarity MD is that we did develop a proprietary technology called PCX that allows us to solubilize things like bakuchiol without the use of a single drop of alcohol. So that means that none of our formulas, especially Clarity MD, have any kind of alcohol in them whatsoever.
It is fantastic. And the vitamin C, we've gotten great results working with sun-damaged skin. So we've got some great before and afters for that. It really restores moisture and also helps build collagen and elastin. So when you're looking at someone that's really spent too much time in the sun and their skin is kind of sagging, this would be the solution that you would want to choose for them. For your basic dry skin, we always go back to the hydrating solution, which is the hyaluronic acid. We also added some chamomile and mugwort. It's very great and hydrating for sensitive skin. If you have a rosacea patient, we recommend this. Also, if you're going to be doing stackable therapies with SilkPeel, which many of the key opinion leader physicians out in the U.S. as well as internationally are starting to do silk peels right before an IPL. They'll do silk peels a few days before a more aggressive laser treatment. And then again, they're doing silk peels right before injections to get firmer, fuller skin so that the injection sites are healthier so that they can get a better outcome. So that's when we also choose the hydrating solution. So Felipe, we talked really about the main differences between SilkPeel and how proud everybody should be when they're explaining that they do have a SilkPeel in their practice. Can we talk also about how it's not operator dependent?
Yeah, absolutely. Actually, that goes back to the dermal infusion story again. So, as we talked about before, basically, we have that recessed diamond tip on the handpiece, and we talked about how the vacuum actually helps to pull the skin up into that handpiece and in contact with those diamonds. And then all the operator really needs to do is really just glide that handpiece down the skin, and they'll get even microdermabrasion every time. So basically, this is another huge point of differentiation between the SilkPeel and other devices out there on the market today. If you look at traditional microdermabrasion or some of the others out there that don't incorporate the use of dermal infusion, which obviously they can't because it is patented and it is proprietary to NV Medical. But basically, the way that you perform these other procedures is that you really have to rely on the operator to be able to do the passes, in a timely manner, especially when you're talking about traditional crystal microdermabrasion. Obviously, if you leave the handpiece on one area of the skin or another for a longer period of time, obviously you're going to, take off more of that stratum corneum. So really, it is operator dependent, and then obviously you do have, other devices out there that really depend on the operator to apply downward pressure onto those hand pieces to be able to get the kind of epidermal exfoliation that they're looking for. In the case of the SilkPeel, definitely it's always going to be operator independent because again, that dermal infusion, really does all of the work for you. Okay, all the operator needs to do is just make sure that the handpiece creates a vacuum seal with the skin, and then thereafter all the operator has to do is just simply glide that handpiece over the skin to be able to get even resurfacing every single time. So every time you do a SilkPeel procedure, it's always going to be reproducible.
Fantastic. So here are some before and afters. And after we do these before and afters, I want to make sure everybody hangs on to the line because we're going to be showing some fantastic videos. So let's look at this before and after.
Yeah, absolutely. So in this before and after photo, you see that we were able to treat melasma effectively with 5 SilkPeel treatments with the Lamixal Pro Infusion solution done once every 2 weeks. So after 8 weeks, you can just see some fantastic results there. In the next slide, we see that we're also able to treat solar lentigos effectively. Again, this particular patient had 6 SilkPeel treatments done with the Lamixal Pro Infusion solution done once every 2 weeks. At 10 weeks, she just looks fantastic. No more solar lentigos. We can treat post-inflammatory hyperpigmentation as well. In this case, we have a patient that received 5 SilkPeel treatments with the Lamixal Pro Infusion solution done once every 2 weeks, and at 8 weeks, she's got no more PIH there whatsoever. When looking at inflammatory acne, as you all know, for microdermabrasion, definitely the treatment of inflammatory acne is definitely not indicated for microdermabrasion, but since we do have that dermal infusion in the SilkPeel device, it does definitely allow us to treat this inflammatory acne. As you can see here, this particular patient, after 6 SilkPeel treatments with the Clarity MD Pore Clarifying Pro Infusion solution done once every 2 weeks, you can see at 10 weeks, this is just another person. No more inflammatory acne. With this particular patient, we were able to treat his cystic acne, again with just 3 SilkPeel treatments done with the Clarity MD Pore Clarifying Pro Infusion solution done once every 2 weeks. At 4 weeks, you can see that that cystic acne is gone, and basically what he's got left is PIH and the acne scarring, which in a few slides we're going to see that we can definitely also treat acne scars as well.
And I wanted to jump in too, Felipe,
Sure.
that this slide and the slide before, and there'll be another
Mhm.
slide in a minute, we've used the pore clarifying handpiece. So that is the one with a disposable tip. That's the brushes. We've got 3 different levels of brushes for the different sensitivities of the cyst-like acne. So if you're looking at a patient and you could not do a traditional microdermabrasion, that's when you go to the pore clarifying handpiece, so that everybody knows we do have that available.
Absolutely. So we just talked about acne scars, right? And so here with this patient, you can see that she's got a little bit of inflammatory acne, but she certainly has just a lot of acne scarring there, a lot of redness to her skin. And as you can see, after 4 SilkPeel treatments with this Clarity MD Pore Clarifying Pro Infusion solution done once every 2 weeks, I mean, at 10 weeks, she definitely is free of the inflammatory acne that she had before, the redness, and certainly a lot of that acne scarring has been completely cleared away. So definitely you can use the SilkPeel not only to treat live acne lesions, but you can also use it to treat your acne scars as well.
And
Sure.
The other thing I like to, just to, so when you're doing these acne treatments, it's so nice to have when the patient comes out, a lot of times they look less red and irritated even after you've done all the extractions with the pore clarifying handpiece. And so they are, especially for your teenage population, it's not a painful experience, and they look better than when they walked in the door a half an hour before, which is very not like the case when you're doing traditional acne extraction. So if you haven't experienced the pore clarifying handpiece, I would definitely recommend you taking a look at it. And I know that the facilities that do have that do a lot of work with it. And if you take insurance, there are many physicians out there in the marketplace that are billing for insurance and getting great reimbursement. So we also have some paperwork for that if you're interested in that as well.
Absolutely. So we talked a little bit about using the SilkPeel for the treatment of hyperpigmentation and acne, but we can also use it to treat photodamage. In this case, this particular patient had 4 SilkPeel treatments with the vitamin C skin hydrating solution done once every 2 weeks. And as you can see, after just 6 weeks, I mean, there's an enormous change there in her skin. You can see that the leathery appearance is gone. A lot of that hyperpigmentation is gone. It definitely, her skin texture has been vastly refined. So definitely, Silk Peel can definitely be used to treat photodamage and anti-aging concerns as well.
And then these before and after pictures, we had a lot of requests this morning, do you guys have this in some sort of book, or how, can I get this? And we do have a flip book, a before and after flip book. So if you all are interested in getting one of those for your practice, at the end of the webinar, we'll put up our email addresses, and you can email me, and we'll make sure that we get those to you. And also, I don't know if we did this, Felipe, at this time around, but if you all have questions to address to Dr. Jimenez, just type those up in the meeting chat, and we will address those at the end of the presentation.
Absolutely, and you can find that meeting chat icon at the top of your screen. It kind of looks like a little bubble. On mine, there's a little red dot on it as well, because that tells me that we've already got some questions there for me to answer at the end. So if you do have any questions, just go ahead and click on that icon and just go ahead and type them in, and we'll get to them at the end of the webinar.
Perfect. I just want to make sure everybody knew how to do that. And then back to the PowerPoint. A lot of physicians out there are getting great response and fantastic patient loyalty by stacking the Silk Peel with IPL, with other fractionated laser, doing it before injectables and fillers. And really, they just have completely different outcomes, and the patients will not go looking for a Groupon for the cheapest Botox in town. They will come and stay with you because you're giving them more than what they could ever expect from another practice. We're going to be showing a couple videos in a minute. One's on lymphatic drainage, and then one's on how to treat the lips, and then one on how to treat the eyes. And for me as a lay person, lymphatic drainage, you're thinking, okay, like massage. I know when I go and get a massage, the massage therapist says, make sure you drink a lot of water because we're going to release all those toxins and all of that. So I know that the Silk Peel does do a lymphatic drainage, but I don't know if we really understand exactly what that means. And since we have you on the call, Dr. Jimenez, we would love for you to help us understand that better.
Yeah, absolutely. So the silk peel can definitely release some of those toxins as well when you're doing the actual silk peel procedure. So as you look on this slide, there's a graphic there to your right, and there's these little dots there. Well, those are your lymph nodes there. So if you look at how we perform the actual silk peel procedure itself, you see that we, especially when you're doing the face area, we actually start at the chin and we work our way laterally to the end of the jaw. Okay, so we work medial to lateral, right? And the reason that we do that is as we're releasing some of those toxins, with the silk peel procedure, obviously we're trying to push those out and back towards the edge of the jaw, the back end of the jaw, where those lymph nodes are. And then if you look at the very last pass that we do with that handpiece on the face, basically you're doing a pass that starts at the top of the forehead, it follows around the hairline, it goes down the ear, it hooks up and around the earlobe, and then it goes down on the neck. So basically what that does is it takes all of those toxins that we moved towards the back, towards those lymph nodes, and then we go ahead and flush those down into the neck and into the body, so we get them away from the face. So that's really what we achieve with this lymphatic drainage.
And it's really nice because people that have, chronic puffy eyes, it really helps them to really drain that out. They won't be as puffy the next day. If somebody has allergies, sometimes they might start sneezing in the middle of the procedure. It's not that big of a deal. Their eyes might water. So just let them know that what we're doing is we're just helping that lymphatic system start to push some of those toxins, down and out of the body. So this slide just kind of explains in detail exactly how you want to do the silk peel, which we're going to show you in just a moment. And here is a great cheat sheet on performing it on the neck and face, and exactly how do you do the first, second, and third passes on each side of the face to get that lymphatic drainage, to do the muscle stimulation, to create collagen, elastin, and to literally to give your patient firmer, healthier skin every time they come in for a silk peel. So Felipe, I think now we should do the lymphatic video.
Sure. Okay, here we go.
When we're talking about lymphatic drainage, what we're doing is we're going from medial to lateral. So when you start on the neck, which is where we suggest you first start, you're going to go nice and slow, and the strokes from the center of the neck, underneath the chin, all the way out to the outside of the neck. And we like to have it at a 3.0 vacuum, and I like to move it up to about an 85 flow, because as you turn the vacuum down, you're going to have to increase the flow so that you get the proper amount of infusion of the solution. So it's like a wet-dry vacuum, so that you go nice and slow so that you infuse, and if you go too fast, you're really not going to get the full benefit of the silk peel. Okay, we're going to start at the center of the chin, and we're going to slowly go down all the way to the ear. So you can see it's a count of 1001, 1002, 1003, 1004. And if she had less elasticity in her skin, if she had a little bit looser skin, you would then also follow, as I'm doing now, with my other hand to give short little stretches of the skin to keep it nice and tight. That way it feels the best. And then I also put my finger right here to close the ear so it's not loud on the patient. So you continue to go all the way up the face, medial to lateral, nice and slow, because if you go too fast, you're really getting more of a microdermabrasion and less infusion. So it's very important to think like you're cleaning your carpets, and when you have a really bad stain, you're going to go really slow over that. So the key is nice and slow. And if you look into the handpiece, you see the solution is about halfway up the handpiece. So you can see right in that disposable tip, and that's perfect solution and vacuum. And that should feel very comfortable for her. And then the last part of the lymphatic drainage is to hook under the ear like so, and then down. So that is a full pass on lymphatic drainage for half the face.
Excellent. I think that is the end of this particular video. Cindy, do you want me to go ahead and put on the eye video?
Yes.
Okay, perfect. Let's go ahead and move on to the eyes.
So now I've changed it to 00, which that means it's a smooth tip. And I'm going to occlude it because now I'm going to bring the vacuum down to a 2.5. So almost as low as the vacuum will go on your silk peel. And because the vacuum is lower, that means I have to increase the flow. So now I'm going to increase the flow way up, like maybe around 90. Because what I want this to feel like on her eyes is like a cool cucumber mask. So I want it to be very, very comfortable, and everyone loves to get their lips and eyes done. So if you're not doing this portion with your SilkPeels, you're really not taking advantage of what SilkPeel has to offer. We like to start right where the outer bone